Hey, glad you could join us. Hopefully you've already watched our original Medicare Part A and B video. This is our follow-up to that, where we're going to talk about Medicare Part D or your drug plans. If you watched that already, then you know that A and B does not cover your medications, and that you either have to add a plan through a Medicare Advantage plan or a standalone Medicare plan. So today I'm going to go right from our booklet that we hand out in our seminars. Of course, you can get a free copy of this. Just drop me a comment asking for it, and I'll be happy to email you a PDF copy of it for absolutely for free. I promise you won't end up on any kind of marketing plans or anything like that. You'll get an email from me. If you have questions, feel free to reach out. Again, my name is Price Bourgeois. I'm with Bourgeois Insurance Agency. Our office is right here in Thibodaux, Louisiana. But of course, we work all throughout the state and several other states for that matter. If there's anything we can ever do to help you out, please feel free to reach out. So let's talk about Medicare Part D. A lot of people do get confused on this, which is part of the reason that we're doing this video. Trying to hopefully clear up some of those commercials and all the mess that you see on the internet. So obviously Part D provides coverage for drug plans and some vaccines. You can get a standalone Part D plan as part of a Medicare Advantage plan or a standalone plan. Part D plans are offered by private insurance company that are approved by Medicare. So Medicare approves the plan, and then it's sold or marketed out by private insurance companies. Of course, you know those big names out there. Every drug plan has a list or formulary. You're going to have brand names and generic drugs that are going to be covered on that. Most formularies categorize drugs into tiers. For example, you might have 5 tiers or even 6 tiers on some drug plans. Typically, what we usually see is tier 1 and 2 will be your generics, and then tier 3 and up will either be higher end generics on tier 3 to actual brand names going up from there. Obviously, you'll pay a lot less for the tier 1 and 2, and it goes up and up from there. They do have to have the most common medications that you find for seniors or people who receive Medicare on those plans. Otherwise, it probably wouldn't do you much good. If you get a standalone Medicare drug plan, you'll pay a monthly premium. Typically, we see this whenever you have someone who's on original Medicare, they get a supplement, and then they add a drug plan. Those premiums do vary from company to company. I mean, I've seen some of them as high as $150 a month, and I've seen some of them as low as $6 or $7 a month. So it's going to vary depending on the company and the plan that you need. It's very important that whenever you're picking that plan, sometimes the $6 plan is perfect. Sometimes the $50 plan is better, because your drugs will be covered better in the higher costing plan. So it really depends. It's very customizable, not customizable. It's very individual, I should say. Some plans do charge a deductible. Typically what we see is tier 1 and 2 won't have a deductible, and then tiers 3 and up will have a deductible. So if you have a tier 3 or up medication, first you'll pay that deductible, then you'll pay probably a copay or co-insurance as you go on. Some plans also set co-insurance rates for certain drugs. So you might have a co-insurance pay for some medications, but not others. Excuse me. So typically we kind of break this down into 4 categories of the way that your plan works. You have an annual deductible. Typically, like I said, you see that on tiers 3 and up. Then you have initial coverage. You stay in that stage until your drug cost has hit $4,430. Once you hit that, you come into what's called the donut hole or the coverage gap. Now you stay in that gap where you'll pay 25% of the cost for both brand name and generic drugs until your out-of-pocket cost reaches $7,050. Now, that's a lot of money because it's about $3,000 or $2,600 roughly. It's a lot of money, but remember, you're also going to get the benefit of the portions that aren't paid by you, and maybe like the manufacturer's rebate, things like that. So you may not end up paying that entire $2,400 because portions of that are going to be added into that coverage or that out-of-pocket cost coming from the manufacturer or something like that. Then after that, you're going to hit the catastrophic phase. You'll pay a small copay or small co-insurance amount. You stay in that stage until the end of the year. Now, drug plans work from January 1st to December 31st. And every year from on October 15th to December 7th, you have an annual enrollment period where the next year's plans will come out and you'll be able to see if you have changes in your drug plan, if you have maybe medications that aren't covered. And it's important that you look at this whether you have a standalone drug plan or if you get your drug plan from a Medicare Advantage plan. For a couple of reasons. If you have a Medicare Advantage plan, it's kind of twofold, because on a Medicare Advantage plan, you could be seeing changes from your doctors, hospitals, things like that, as well as your drug plan. So it's very important, no matter which way you're getting your medications through Medicare, that you do take a look at it. Also, if you don't enroll in a drug plan when you're supposed to, you could end up paying an additional 1% of the average Part D cost for each month you delay enrollment, which could be very expensive, especially if you wait 5-6 years, which I've actually seen. So you want to do it right away. If you have no medications at all, and you're like, well, why would I pay this? Well, eventually you probably are going to need a drug plan. So maybe just go on to the lowest possible cost. But again, it's an individual thing. I would certainly not go without a drug plan, even if I didn't have a medication. So from there, that's the basics of your drug plans. From there, really, we're going to start getting into Medicare supplements, Medigap plans, and Medicare Advantage plans. Kind of the differences, what you need to be aware of, and what the ramifications of each of them are, because some people love one, not the other, and vice versa. There's goods and bads on all of it. So stay tuned. Go ahead and hit that like, subscribe, give me a comment. Hey, we do appreciate everything y'all send to us, and every comment really does help us out. So that's going to conclude our Part D plans. If you have any questions, please put them in the comments.